So we're talking about the different types of sugars, but one of the most common sugars that we're seeing now is high fructose corn syrup. High fructose corn syrup, and I just found this out,
Mhm.
was discovered in the 70s, 1970, but now it's being used in drinks, all the drinks,
Yeah, all the
all
drinks
the
have it.
drinks,
Sugary drinks.
processed foods, ultra processed foods. What's a processed food? It's
All your
pretty
canned
much
food.
everything.
Yeah. Your
Potato chips,
cereals.
cereals,
Oh my
everything.
goodness. It's
It's high fructose corn syrup. And
yeah.
the breakdown or metabolism of the high fructose corn syrup is very different
Mhm.
than glucose, for example.
Yeah.
And I think there's a lot of research on it, but it's been indicated that the increase in high fructose corn syrup is responsible for most obesity.
Right.
Uh, to me,
Sadly.
it's shocking that 74% of Americans are either overweight or obese.
Mm-hmm.
Even more shocking to me is that 50% of children
Mm-hmm.
today are overweight or
Right.
obese.
Right.
That's something that we never used to see. So that being said, let's uh, let's dive into what we call the three pillars of health.
Mm-hmm.
We talk about nutrition, which is your forte. Okay, we talk about sleep,
Mm-hmm.
and we talk about exercise. So let's start off with nutrition because nutrition is critical in controlling and managing diabetes.
Right.
It's critical. But someone tells me you got to eat healthy. I say, okay, but what is healthy? Yeah,
Exactly.
let's dive
Yeah.
into that.
And so when going back to the fructose, what happens to just to add on that
Hmm.
is the microbiome, and
Yes.
so it kind of has a hard time seeing this as how am I supposed to digest this?
Yeah,
This is
microbiome being
this
the bugs that
yeah
live in us
right,
or are
the
supposed to live in
bacteria,
us.
this
Right,
our
right,
intestinal line, and
right.
so then what happens, and we have inflammation because of not knowing how to process what is supposed to be food. Which really, if you look at a cereal box and you look at the ingredients, and the first ingredient is going to be the corn syrup, which is going to be not good. And
Yeah,
so if you, it really doesn't take much just to kind of look at your ingredients in your granola or your cereal box, and basically you probably can't even read most of what you're eating. And so these are all chemicals, preservatives,
yeah,
processed foods that your
right,
body doesn't know how to deal with them. And so
right.
then what do we have? Stomach pains, inflammation, obesity, fat cells. Then again, we start developing all these chronic diseases, and of course, one of them being diabetes.
Right.
And so, back to the pillars of nutrition. Nutrition is fundamental because yeah, there's medication and there's that will probably take care of the symptoms, but the underlying condition has to start off with
What are we putting
what are
in?
we
Hmm.
feeding our bodies? Like
Yeah,
we just talked about how our bodies are just our machines are just amazing. I mean,
right,
all these cells and the way
right.
our body works, and you would think, why not give it the right fuel?
It's just like an automobile. You
Exactly.
got to put the right kind of
Right.
gas in. You could put
Right.
gas with a little bit of water and it'll
It's
still,
yeah,
but
but
no,
the quality
yes,
is just not, you're not going to run at 100% if
right.
you're not giving it that right fuel. And so nutrition does play a huge role. And so when we talk about diet, and so diet is a misconception. It's because then we kind of think people have diabetes and they're like, I have to get on a diet. It's already negative,
No,
it's already restrictive, it's already, I don't want to, don't invite me to, I don't want to go anywhere anymore because I can't eat. And basically, like what you're saying, it's eating healthy.
it's a
It's
lifestyle
a
change.
lifestyle change.
Yes.
It's just it's anything we put in our mouth is what's considered a diet. But eating
Hmm.
healthy is if you ask somebody, I'd rather not have the piece of cake because I'm eating healthy. Then people want to say, well, what are you doing? It's a positive note. I want to do what you're doing. But if you say, well, I'm on a diet, it's kind of like, well, poor
Yeah.
you. You
Yeah.
gotta live life, and it's
Yeah.
okay. One's not gonna hurt, and so when we change that mentality, then it becomes so much easier. And you're right.
Right.
So what is eating healthy? Eating healthy is having variety.
So they talk about the different colors
The
on your plate.
So
What
we
does
go
that
by
mean?
like the My Plate. So there is
Uh-huh.
a website called myplate.org, and it's a reputable source that you can go into, and
Myplate.org.
myplate.org,
Uh-huh.
and basically it's a balanced meal which has flexibility, options, variety. So you don't want to have just chicken and watermelon for the rest of your life either. You want to enjoy your food.
Yeah.
And so this My Plate is going to be composed of a lot of vegetables.
Yeah.
Vegetables is going to be half your plate, and a quarter of that might be your grains, and the other quarter is going to be your protein. And so, going back to nutrition and diabetes, fiber is my number one to go to. I mean, fiber is needed for anybody, even if you don't have diabetes. And unfortunately, as Americans, we don't
So
consume.
let's talk about fiber. I mean, we're not talking t-shirts or clothes. Not that kind of,
Yeah,
that would be cheesy, right?
that would be cheesy.
Yeah, no, no, no. Okay, so what is
So,
fiber?
so fiber, you're going to find fiber in your fruits and vegetables. Now,
Mm-hmm.
fruit, people are fearful of having fruits because, I mean,
The
it has
sugar.
sugar, it has fructose, but it's natural. And
Yes.
the difference between, again, talking about the different kinds of carbs, is that fruit has fiber. And so it offsets. And so when you
Mm-hmm.
have diabetes, fiber has three functions. And so, fiber, one of the biggest and most important, especially with diabetes, is that it stabilizes glucose. And so, when you have some salad or vegetables along with perhaps some rice, it's going to stabilize your sugar levels. So we want to have fiber at every meal, which means vegetables or fruit. If you want to have fruit in the morning with your breakfast, and people say, I don't like to have vegetables in the morning, but then surely you can have
An
perhaps a
apple.
green shake.
Mm-hmm.
Maybe in the morning
Mm-hmm.
with your
Mm-hmm.
celery and spinach, and
Mm-hmm.
a great, great green shake in the morning. But so fiber will stabilize glucose. It'll
Mm-hmm.
help you stay regular. Now, we want to have daily bowel movements. Another thing that I do see with my diabetes patients is a lot of constipation. And why? Because of the foods that we're putting into our body. Again,
It doesn't work.
we're not, our microbiome, again, it's the digestive system is low. We
Mm-hmm.
may be suffering from gastroparesis because our sugars are high. And so then we want to eat fiber to make us stay regular, and use the restroom and have bowel movements daily. And thirdly, it helps with weight management.
Mm-hmm.
So having a daily, you can have fruits and vegetables, but also if you want to take a supplement of fiber, just a
Mm-hmm.
psyllium husk, 1 teaspoon a day, and of course, lots of water. We want to make
Mm-hmm.
sure we're hydrating and we're
Flushing
kind
out.
of flushing out.
Mm-hmm.
And so it's not a laxative. It's not going to be, there's
Mm-hmm.
also that misconception. If I have this fiber supplement, well, then it's a laxative. I'm going to make my intestines not work the way they should work.
Right.
And I don't want to get
Right.
them used to having, but
Right.
it's fiber. And it's
Fiber.
going to help with the sugars. So we want to have fiber with our meals. So that's part of, when people ask, well, what is eating healthy? Well, do you have vegetables? Is there color in your plate? And if it's brown, if it's all brown, then hey, okay, we're having enchiladas, rice and beans, and
Sounds
okay,
good about
it
now.
sounds good, but there's really no fiber. So we
Right.
want to make sure. But there's so many good tips to incorporate, like that green shake that I was just talking about
Right.
earlier. And
Now going to that, if you do a green shake,
uh-huh.
is there a difference? You hear about juicing,
Hmm.
you hear about, just doing a shake in a blender.
Hmm.
Um, in my mind, I'm thinking when you juice, you're removing fiber, are you not?
Right, because you're
So
extrapolating.
what's your take?
You're extrapolating now. The thing about juicing, I'd rather you put it in the blender and kind of
Cool.
just take
It's
everything.
easier to
It's
do
easier,
anyway. Yeah. Okay.
and so then the only thing about when you put things in the blender, I hear people that say, well, I put like 3 to 4 portions of fruit. And
All right. Yeah.
and so we
Yeah.
want
Yeah.
to also,
Yeah.
we
Be
can eat
reasonable.
fruit, but we want
Yeah.
to be mindful on our portions.
Yeah. And just
And
because it's a
so
shake, don't put ice
Right,
cream in
and
it
so
either. That's right.
exactly.
That's right.
So we
Okay.
so that's the importance of having fiber and the great benefits. So that's a great take, is have your fiber, have your greens with daily. Not, yeah,
Simple.
I like vegetables, but yeah, maybe every other day or maybe,
So, and what you're saying about a green shake, it's so easy. You can prep it.
yeah,
You can do cut up vegetables, store them in a baggie, throw it in the freezer, and in the morning take it out, drop it in the blender, put some water in it,
yeah, and it
and
tastes good.
you
It's
can put
great
a little
fiber,
papaya in it, maybe,
digestive
whatever.
enzymes.
Yeah,
You also want to throw in a little bit of ginger
yeah,
just because of its great health benefits.
yeah.
So it's just it tastes good, and when you kind of start doing these things for you as self care, it just kind of empowers you.
You start
You,
feeling better
yeah,
too.
you feel
Yes,
empowered, and so you want to take charge.
yes.